Welcome back to MSNBC Live. I'm Carlos Watson. Now, with the August recess looming, healthcare negotiations are continuing on Capitol Hill today. After 6 hours of negotiations, House Democrat leaders and key Blue Dog Democrats broke up last night without a deal. Republican Congressman from Wisconsin, Paul Ryan, now joins us. Congressman Ryan, good to see you, sir.
Hey, Carlos, Katrina, how you doing today?
Good, very well. Now, you wrote recently in an op-ed in the Milwaukee, Wisconsin Journal on July 18th, before members even had time to read the 1,000-page bill, it already has cleared two major House committees and is set to be fast-tracked through Congress in the days and weeks ahead. Those members of Congress who voted for this bill already in their committees did so without knowing what the legislation costs. Before it's too late, let's take a closer look. Now, Congressman, I know not only have you been in Congress for several terms, but you worked on the Hill for a couple of different senators, and you know this issue's been around for a long time. Are Republicans being genuine in their complaint that this is moving too quickly?
Well, yes, I don't think we should pass bills that we haven't read, that we don't know what they cost. I mean, I don't think that's being effusive. I have already proposed other legislation. A number of Republicans are proposing alternatives. You can look at the Patient's Choice Act on my Facebook page, and you'll see there are many proposals that we put out there to say, let's get everybody insured. Let's get everybody insured who has pre-existing conditions. You can do this without the government taking it over, without all these new taxes and new spending programs. And so we want to see health care reform done, but we want to do it right. And if you rush this thing through before anybody even knows what it is, that's not good democracy. That's not doing our work for our constituents. What's wrong with going home for August, having town hall meetings, listening to our constituents, and then coming back in September and doing this right?
What about the reverse? What's wrong with staying in session at a time when 14,000 Americans are losing their health care every day, in which people are going bankrupt, in which we know we've got a real problem here, and more people are losing it as they lose it? What's wrong with Congress stopping all of that and staying in session and working through it for the good money that they get paid?
So you don't think we should go home and listen to our constituents? You don't think we should go home and have town hall meetings?
I think that you go home each weekend, and I think that you guys have been correct. So it's not as though it's one or the other. You're able to both listen to your constituents, which I agree is an important thing to do. Don't disagree with that at all. But I don't know that you need to be gone for a month. And you and I know that a lot of people aren't simply going home for the weekend to listen to their constituents. They're going on junkets to Italy. They're going overseas to different parts of Europe. You and I know that that's going to be more often the case.
I'm doing a dozen town hall meetings on health care, not going to Europe or anywhere else like that. But let's just concede the point. You're right. We could work this thing through, but we shouldn't rush this thing through just to rush it through for some artificial deadline. Let's get this thing done right. And so, look, we have differences of opinions here, but the problem that this plan has experienced is it has run face into the facts. And the facts are the Congressional Budget Office is telling us this makes our fiscal situation worse. This increases health care costs. It doesn't decrease health care costs. This program, this new entitlement that's being proposed, grows faster than Medicare and Medicaid. It creates huge deficits now and even larger deficits in the future. That's not my opinion. That's what the Congressional Budget Office is telling us. And that does not meet the president's proposal. That does not meet the president's goal of bending the health care cost curve and being deficit neutral.
Representative Ryan, I want to ask you, you have good government plan health care. Why shouldn't all Americans have what you have?
I have good private sector health care. We do not have a public sector. We don't have a public option.
Plan.
Yes, that's right. The federal employee plan, a list of private plans to choose from to select, and my employer, you, the taxpayer, pays for a portion of that, of these private plans.
With a public plan option.
There is no public plan option in the federal employee health benefit plan. You're mistaken on that point. And so my Patient's Choice Act that I've introduced with Congressman Nunes, Senators Burr and Coburn actually proposes just what you're sort of suggesting, which is give people the ability in state-based exchanges to have a plan just like the one we have here in Congress, a private health care plan that's actuarially equivalent to what we in Congress have. We actually had a vote, Katrina, in the Ways and Means Committee, which was an amendment I had with Dean Heller that said, let's put all members of Congress in this public health care plan so that we can experience the same thing we want to impose on the rest of the country. You know what? That amendment failed. It failed on a party line vote.
It sounds like an Representative Ryan, that sounds like an anti-competitive vote. Competition is at the heart of America, and to deny Americans competition by denying them the option of a public plan seems to me un-American.
You know what's weird about that line right there, Katrina, is I know you and others are very much in favor of a single-payer plan, which is obviously to deny competition and have the government run it all. What's concerning about this debate with me is you're using capitalist rhetoric to try and move a plan that is inherently anti-market. The problem is the facts tell us this. The public plan option quickly becomes a government-run monopoly, and the reason is the public plan has so many inherent advantages against the private sector that the private sector can't fairly compete. And what the actuaries are telling us is in a few short years, the public plan option displaces the private sector. Employers dump their employees on the public plan, and then they have no choices but the public plan. And so let's not try and sell a government-run plan using free market rhetoric. Let's have an honest debate about what this bill is all about.
Congressman Ryan, I want to come back to this conversation, and while you're in Wisconsin next month, I hope you'll join us from Wisconsin, because I'd like to continue this conversation.
If you're willing to come to Wisconsin, we'd be happy to have you.
Would love to do that, or at least do it via satellite. Thank you for joining us today. Very much appreciate it.
Nice
Coming up, with the popularity of